This section of the video will have to do with the maintenance of a midline and how to do so. In terms of flushing, midline catheters are to be flushed with a pulsatile technique before and after each use and every 12 hours when not in use with 10 milliliters of NS and at most a 10 milliliter syringe. Midline catheters may be used for lab sampling in accordance with manufacturer indications and guidelines. So prior to sampling, flush the line with at least 10 milliliters of normal saline to assure patency. You would then clamp the extension set. Then remove the cap from the hub of the extension set and scrub the hub with chlorhexidine or an alcohol-impregnated swab. Using a 10 milliliter or smaller syringe, slowly pull at least 5 milliliters of waste from the catheter and discard. Using a 10 milliliter or smaller syringe, slowly pull enough blood for the required lab sample. Clamp the extension set and then remove the sample. Attach another 10 milliliter saline flush, then unclamp the extension set and flush with at least 10 milliliters of normal saline in at least a 10 milliliter syringe in a pulsatile technique. At that point, you would then replace the cap. If you are having difficulty with lab draws, you need to aspirate with a 3 milliliter syringe. While a 10 milliliter syringe creates little PSI going forward, it creates a tremendous amount when you pull back, and the opposite is true of the 3 milliliter syringe. This will help keep the line patent for blood draws. Additionally, place a tourniquet on the arm 6 inches above the insertion site to allow for venous pooling, which will help tremendously. This isn't a central line. You have to treat blood draws like any other peripheral lab draw and use the tourniquet. Additionally, adding heat to the arm can help cause vasodilation and help with venous pooling. Thank you for watching. If you enjoyed this content, consider liking the video. Leave us feedback in the form of a comment if you have any questions, concerns, complaints, or compliments. If you want to see more content like this, consider subscribing to see more footage like this. Till next time, stay safe.